So I'd like to get jump started into some of the internships and clinical opportunities that Kiro has had, as well as some of the clinicals that Jacob looks forward to having.
All right, so I'll tell you guys about everything I've had so far. So I've had quite a resume, actually. I'm kind of proud of it. But so I've worked first at the Children's Hospital in the pathology department because I knew I wanted to work in some kind of research opportunity. And I was able to find that opportunity, and I worked there as an intern. It was mostly, like filing things, but at the same time, it was really good to see, like, to work in a hospital, in a lab, to see all the specimen and all these cool things. And that was like an opportunity I did freshman year. And then after that, right now I work as a pharmacy technician at CVS Pharmacy near my house. But right now in the summer, I got my pharmacy intern license, and I can work as an intern with a white coat, which I'm really excited to get to do. But those are like some of the things we can do. Also, what happens when you're in a the PharmD program, you have 6 years, and some of those 6 years during the summers, as well as sixth year, you have to do something called clinical rotations. And those are like kind of matched with the school for you. And those include hospitals, so internal medicine, something like that, retail pharmacies and community pharmacies, as well as different elective rotations, they call it. So you can be like in a veterinary pharmacy kind of place. You can do one in a pharmaceutical industry, so you can get like kind of a residency or something like that in there, as well as different fellowships and things that we have for students that are placed in. So I do my first my first rotation, which is a community setting, so like CVS or Walgreens, after my third year. So after next year, I do that one. But the best thing is, because all of the CVSs and all the hospitals are in the area, I was able to get kind of my foot in the door in the first place and learn about these things earlier. So I'm able now to tell people about the different drugs, just from learning, filling these drugs, talking to the patients, all these different things at the pharmacy. I kind of learned the most important drugs that I need to know. So I kind of had a head start on third year and all these things. So those are just some of the things I've done, and hopefully I do more things. But yeah. All right.
So my experience is obviously a little bit different than Kiro's would be. I'm a first year nursing student, whereas he's a pharmacy student. So the clinicals and the rotations are going to look a little different. For me, in the first year, I was able to get a volunteership at Massachusetts General Hospital, specifically the eye and ear branch. And growing up, I always wanted to be a nurse, but specifically a pediatric nurse. I've always worked with children. That's always been one of my goals. So I was able to actually get my volunteership in the pediatric surgical unit. So I'm working with nurses, doctors, like helping them out, doing patient transport, working with the families and all different stuff. So definitely like a lot of opportunities to get your foot in the door first year. Like it was my third week of school when I got the interview. So I was able to really like take a hold of the advantage of the Longwood medical area and just the city of Boston in general. And in terms of clinicals, something that I really like about MCPHS is second year, you're going to start your clinicals, specifically your spring semester. And then after that first spring semester, you can become a certified nurse assistant for the nursing program, which means you can get a job at any hospital as a nurse assistant, which is just really good because then after that first semester, you can have a whole year practicing as an assistant to a nurse before you graduate, and then you're getting there for the real deal.
Sarah, can you talk a little bit about some of the opportunities that you've had with research at MCPHS?
Yeah, so I've done research for a couple semesters now. And when I first started doing research, I actually got my first internship off of Twitter. I had messaged a doctor from Mass General, and he was like, send me your resume. And he set me up. So that was the first time that I got into research, and it was great. It was in trauma surgery, and I was like, oh my God, I love trauma surgery. I did that for the entire summer after my sophomore year and a little bit into the fall and spring. And then from there, I kind of geared it in a different direction. So in the fall and in the spring, I started doing research at Boston Children's Hospital. And I found that just by going on the Boston Children's Hospital website. And if you go under research, you can search through all the different labs that they have. And I found my lab, it's an endocrinology lab. I'm really interested in endocrinology, so I went through all their publications and I found one that I understood and I liked. So I messaged their principal investigator, and I also connected it to the school, so I was able to get school credit for doing this internship, because a lot of research internships, they don't have a lot of money because everything is run on like grants. So that's one thing that the school is really great about doing, is coordinating with these research labs to get you like class credit. And so that's what I've been doing last semester, and then this semester I was doing it. And there's probably about like 20 other kids who are currently doing research at these other labs too. So there's a good amount of people who are doing it. And it's relatively easy to organize, especially with the school. So